Hello, my name is Georgia Martin, and I'm a registered nurse at St. Luke's South Tele, and I'm going to be talking about a needs assessment that I conducted on the St. Luke's South telemetry community. So, this community consists of 19 patients, and they're always changing. Patients come and go every day, and also staff as well were used to implement interventions based on our needs assessment. So, the um, key focus was obviously the patients. We want to make patients more satisfied. We want to know what we can do to improve their stay. As St. Luke's motto goes, best place to give care, best place to get care. So we want to follow that as best as we can. So the needs assessment was conducted by means of a survey. So the patients were given 10 questions asking about their age, their marital status, also improvements that they thought needed to happen on our floor. So the result of that survey showed that 7 out of 10 patients were complaining about lack of sleep and getting interrupted during their sleep and, just feeling sleep deprived. So that was decided to be the key problem for this needs assessment project. And from there, we were able to look and see what kind of interventions we could do for our patients lacking sleep. And actually, other hospitals in the St. Luke's area do something called quiet time. This is basically a time during day shift and night shift where the patients are uninterrupted unless, it's a critical emergency and they need care. But otherwise, if they're stable, they're doing okay, they're allowed these 2 allotted hours to just have total uninterruption. So for day shift, that's going to be 2 a.m. For day shift, that's going to be 2 p.m. to 4 p.m. And for night shift, that's going to be 2 a.m. to 4 a.m. So those patients that are not critical are going to be allowed to get rest, a good, solid, uninterrupted rest without interruption between those hours. Also, during day shift, the lights are going to be dimmed for the patients out in the halls, no visitors. It's just going to be quiet. Staff is going to be, try to reduce their noise levels in the halls. And then the patients were surveyed. Another 10 patients were surveyed after implementation of the quiet hours, and 8 out of 10 really raved about them. They thought it was a great thing that they were able to get more rest, feel more rested, and had a better experience having those quiet hours. And there was really, out of the 10, no complaints about the quiet hours. So the implementation seems successful, and I hope that it is something that will be able to be continued for better patient satisfaction and better outcomes for staff and our patients. Thank you for listening.